Henoch-Schonlein Purpura, also known as HSP or immunoglobulin A vasculitis, is a type of inflammation of the blood vessels and is the most common type of vasculitis seen in children. In this scene, we will lay out everything you need to know about HSP. Finally, a little peace and quiet away from the noise and lights of the city. You've taken the night off from studying to do some stargazing at the old family farm. You're set up to stargaze for the night in your trusty hammock, which sounds like Henoch, right? It's the Henoch-Schonlein Purpura hammock. Get it? Now that we've set the anchor for this scene, let's move on to discuss the cause of the disease. As mentioned at the start, HSP is the most common vasculitis seen in children. Vasculitis refers to inflammation of the blood vessels. The various types of vasculitis are categorized by the size of blood vessel they affect. We can remember what kind of vessel HSP affects by looking at this small puddle of water on the ground right underneath your hammock. This small puddle is a small vessel of water, which represents small vessel vasculitis. Got it? HSP affects these small vessels, like the capillaries under your skin or in your kidneys. It is therefore categorized as a small vessel vasculitis. So what actually causes HSP? Well, notice these Y-shaped hay bales? You know, those hay bales actually remind me of Y-shaped IgA antibodies, since antibodies look like the letter Y and hay sounds like the letter A, right? Putting this together, we get antibody-shaped hay, or Ig hay. This is obviously here to represent the IgA antibodies involved in the pathogenesis of HSP. HSP is actually an example of type 3 hypersensitivity, caused by the deposition of circulating immune complexes of antibodies bound to antigens. The antibody that forms these complexes is IgA, which you can remember as these Y-shaped hay bales here. It's cold out here at night on the farm, and it looks like our stargazers caught a chill. While unfortunate for him, it's lucky for us because his upper respiratory infection, or URI, helps us remember that most cases of Henoch-Schonlein Purpura tend to follow URIs. Basically, this disease happens after children get a viral infection like a cold. The pathogenesis of HSP is thought to be related to the significant increase in immunoglobulins, including IgA, produced by the immune system in response to infection. Poor guy, I think he needs another tissue. So now that we know the pathophysiology behind HSP, let's talk about how the disease presents. HSP classically presents as a clinical triad of symptoms which we'll cover in detail. Looks like our stargazer wasn't being careful when he coughed and ended up splashing his pants with water from the puddle. Or maybe he got sick because he got wet earlier. Wait a minute, those splashes kind of remind me of the distribution of the purpura in HSP, or darkened skin lesions classically located on the lower legs and buttocks. This purpura should be easy to remember, since the disease literally has purpura in its name, Henoch-Schonlein Purpura, right? Purpura are discolored lesions of the skin that are slightly raised and are therefore palpable. They are the physical manifestation of blood leaking or bleeding out of small capillaries under the skin. This makes sense since we've already talked about how HSP is caused by deposition of IgA immune complexes in these small vessels. When these complexes deposit, they cause inflammation and vessel damage, and the resulting leak manifests as palpable purpura. Pretty neat, huh? Oh! It seems that when our stargazer got cold and coughed, he accidentally dropped his telescope on his belly. Looks like he's got a painful abdomen now. By the way, this picture should remind you of intussusception and abdominal pain seen in HSP. Abdominal pain happens in HSP when IgA immune complexes deposit in the small vessels of our intestines, like our mesenteric vessels. The resulting inflammation causes abdominal pain. This inflammation also serves another role as a lead point or starting point for intussusception. This is basically a fancy term describing when one part of the bowel telescopes into another. Intussusception, if left untreated, can result in necrosis through cutting off of blood supplies and can be a life-threatening complication in patients with HSP. What better way to remember a telescoping of intestines and abdominal pain than a telescope hitting our stargazer right in the gut? The last part of the triad is arthralgias, or joint pain. To be frank, the triad is historical, and joint pain is a nonspecific finding seen in nearly all autoimmune conditions. As such, we think this fact is pretty low yield, so we didn't symbolize it here. As long as you can identify the other two clinical signs, abdominal pain and palpable purpura, you should be good to recognize HSP on test day. So now that we've covered the clinical presentation of HSP, let's talk about some of the less obvious findings we might see on pathology. We've already talked about how IgA immune complexes can deposit in the skin and the intestines to cause symptoms in HSP. These complexes also deposit elsewhere, and to find out where, just take a look at that glowing barbed wire fence on the side. Of course, every farm has electrified barbed wire, and this one is no exception. This barbed wire is even glowing so that it looks like a tuft of blood vessels, kind of like a glomerulus. You bet that this glowing tuft of wires is our recurring symbol for glomerulonephritis. Due to this glomerulonephritis, patients may present with hematuria or elevated creatinine levels. In the setting of HSP or IgA vasculitis, when we take a look at the kidneys in particular, we see IgA nephropathy, which is essentially IgA vasculitis within the kidneys. Basically, the same pathophysiology, just in the context of a different organ system. IgA nephropathy is also called Berger's disease, which is very different from Buerger's disease, another type of vasculitis that we will cover in a separate video. Another quick note, this IgA nephropathy is a separate disease process from PSGN, or post-streptococcal glomerulonephritis. We wanted to make this note because both diseases can present after URIs, an easy place to get tricked by board questions. Buerger's disease is caused by IgA immune complex deposits and mesangial proliferation on light microscopy, while PSGN has deposits made of IgG, IgM, and C3, with hypercellular glomeruli with subepithelial deposits, giving it a lumpy bumpy appearance on electron microscopy. So before we get back to searching the night skies, let's recap. Henoch-Schonlein Purpura, also known as HSP or IgA vasculitis, is the most common small vessel vasculitis in children. Cases are commonly preceded by upper respiratory infections, and the disease is caused by deposition of immune complexes consisting of IgA antibodies bound to a circulating antigen. In other words, HSP is a type 3 hypersensitivity reaction, and the deposition of IgA immune complexes in various sites leads to the symptoms of the disease. Immune complex deposition in the small vessels of the skin leads to palpable purpura over the buttocks and legs, while IgA deposition in the small vessels of the GI system can lead to abdominal pain that may be complicated by intussusception. Immune complex deposition in joints leads to nonspecific arthralgias, and deposition in the kidney leads to glomerulonephritis. In particular, IgA-mediated vasculitis in the kidney is also known as IgA nephropathy or Buerger's disease. Wait, was that a shooting star? Well, you won't need to waste that wish on memorizing HSP thanks to this mnemonic. Catch you in the next one.